Hello everyone, this is Dr. Shweta Anand and welcome back to my channel Simplified Dentistry. In today's video, let's discuss about infected dentin and affected dentin. So the dentin becomes infected as a result of carious lesion formation on the root surface and when the lesion progresses following cavitation of enamel lesions. So before knowing in detail, first let's know what does infected and affected means. So infected means that it has bacteria, that is, it is infected with bacteria and you want that bacteria to go away, so it has to be removed. Whereas affected means it was affected by the process but bacteria is not present and it does not have to be removed. So infected dentin is the superficial layer which is soft and demineralized, invaded with bacteria, and collagen is irreversibly denatured. So the denatured collagen cannot act as a matrix or a meshwork for remineralization. So this layer cannot be remineralized and must be removed. Affected dentin is the deeper layer and it is also demineralized but not yet invaded by bacteria and contains reversibly denatured collagen, so it can still act as a meshwork for remineralization and acts as a matrix for bonding. Therefore, this layer does not require removal and is preserved. Now let's have a look on the differences between infected dentin and affected dentin. So the infected dentin is the superficial layer of demineralized dentin, whereas affected dentin is the deeper layer. Infected dentin is highly demineralized, whereas affected dentin is intermediately demineralized. In the infected dentin, intertubular layer is demineralized, whereas in affected dentin, intertubular layer is partly demineralized. Infected dentin cannot be remineralized, whereas affected dentin can be remineralized. Infected dentin has high concentration of bacteria, whereas no bacteria is found in the zone of affected dentin. Infected dentin is soft and leathery in consistency, whereas as compared to the infected dentin, affected dentin is harder in consistency. Infected dentin is soft due to the lack of mineral content or the collagen network. Affected dentin is firmer than infected dentin due to the presence of the collagen network and the mineral content. The infected dentin contains soft leathery tissues which can be flaked easily, whereas affected dentin does not flake easily. There is irreversible denaturation of collagen in the infected dentin, whereas in affected dentin there is uninterrupted collagen cross-linking. In the infected dentin, the collagen fibers are broken and appear as indistinctly cross bands, whereas in affected dentin, distinct cross bands are present. Infected dentin lacks sensation, whereas affected dentin contains sensation. It is sensitive. Caries detecting dyes can stain the infected dentin, whereas it does not stain the affected dentin. It is important to remove the infected dentin, whereas affected dentin should be retained. Hope you liked this video, and for more such contents, please subscribe to the channel Simplified Dentistry.